Babies cry a lot. At first, the only way a baby can communicate is by crying. While no one enjoys hearing a baby cry, it can be particularly triggering for some moms. Here's what you can do when your baby cries. First, take a deep breath and allow yourself a moment to respond in a calm manner. If you're not holding your baby when they begin to cry, you can talk to your baby in a calm and reassuring tone. I'm coming. Someone's wide awake now. You're not happy. Let's see what we can do. Will your baby understand you? No, not for months, but they will know they're not alone, that you've heard them, and that how they feel matters. Just hearing your voice can tell your baby that help is on the way. No need to panic. You can assess whether or not intervention is needed. Most of the time, when a baby cries, they just want a little love and reassurance. But sometimes picking them up and talking to them isn't enough. The following is a mental checklist that can help you remember common causes of crying. HTB triple D. H stands for hungry. When was the last time your baby ate? How many ounces? T stands for tired. When was the last time your baby slept? For how long? Are they tired? B is bored. Does your baby need stimulation such as interaction, playtime, or a change of environment? Walk around the room together or step outside. Mix things up a bit. Go for a walk. Try different things to see what works. The 3 Ds are diaper, discomfort, and dressed. Check your baby's diaper. Does she need changing? You may have just changed her, but it still could be wet again. Is your baby experiencing discomfort? Is the light too bright, the noise too loud, or is her belly swollen from gas? The last D is dressed. Could your baby be too hot or too cold? The general guideline is for you to dress your baby in 1 more layer of clothing than you are comfortably wearing. Ways to reduce crying. Try to catch your baby when they wake up from a nap before they begin crying. This habit can sometimes teach a baby they don't need to cry to get your attention. Over weeks to months, gradually increase the time between their waking up and you coming to get them. This can increase their ability to self-soothe and entertain themselves. Coming before they cry teaches them they can rely on others to care for them. They don't always have to cry to get their needs met. For some babies, this window is very short, and some wake up crying. Oh well, not much you can do about it there, but soothe them as best as you can. They're all different, born with innate temperaments. Listen carefully to your baby. During the first few months, you will notice that your baby has different cries for different needs. Their hungry cry is not identical to their overtired cry. The sound of your baby's cries can be another clue as to what they need. Sometimes we never figure out what the cause of the baby's crying is. Perhaps there's no apparent logical reason for why your baby's crying. Some babies just cry a lot. This can be exhausting for parents. In his book, The Happiest Baby on the Block, Dr. Harvey Karp describes a technique he developed called the 5 S's. This is a highly effective method of calming a crying baby. Many parents naturally do wonderful and effective things to calm their babies, such as swaddling, rocking, or using a pacifier. But Dr. Karp noticed you can increase the efficacy of each of these techniques by combining them all at the same time. Doing these 5 steps simultaneously elicits your baby's calming reflex by imitating the environment your baby experienced in the womb. Utilize these techniques when your baby's fussing or it is time for them to sleep. I will describe it here, but I think the best way to learn the 5S technique is by watching his video. Watch it with your partner so you can both know how to soothe your baby. Dr. Harvey Karp's Happiest Baby on the Block 5 S's. Swaddle, side or stomach position, shush, swing, and suck. The type of swaddling he recommends is to have the baby's arms snug down by his or her sides with the hips being loose. Although your baby may want their arms by their face, having them loose can disrupt their sleep. Avoid overheating the baby with excessive clothing. Don't let them roll onto their stomachs while being swaddled, and be extra careful about blankets unraveling. Once your baby can roll over, it's time to stop swaddling. The second S is a side or stomach position. Once your baby's swaddled, hold your baby facing out on their side on your forearm. Apply some gentle pressure on the stomach. Remember to only use this position while holding your baby, not when putting them down to sleep. Babies should always go to sleep on their backs. The third is the shush sound. Make the shush sound or white noise to imitate the pulsating sound of blood flow your baby heard while in your womb. Babies are not used to silence. The womb is actually quite noisy. Fourth S is swing. In a rhythmic motion, rock, sway, or swing your baby in a manner that recreates the feeling of the movement of the diaphragm moving up and down as you breathe. An alternative movement that works is by placing one hand on your baby's back and holding him to you, and the other hand in the diaper area and gently rocking your baby's bottom with your hand. The fifth S is suck. The sucking motion is extremely calming for babies. You can feed your baby or use a pacifier if your baby's not hungry. Pacifiers are safe to use. In fact, research has shown pacifier use can decrease the rate of SIDS. It is generally recommended to wait until breastfeeding is firmly established, usually about by week 3. To avoid reliance, don't use pacifiers during awake times. As your baby gets older, encourage him to learn to self-calm while awake without a pacifier. Wean your baby off the pacifier by age 2 to allow normal tooth and palate development. How much crying is normal? Well, babies cry a lot, and I mean a lot. They cry when they're hungry, when they're tired, when they're overstimulated, when they're bored, when they're cold, warm, when they're uncomfortable, when they're overtired, when they're scared, when they have ennui. You get the idea. It's what they do, and in their first couple months of life, crying is their only way of communicating. So they use it, and they use it a lot. It's not manipulation, it's communication. It's a signal that they need you to be there for them. Sometimes you can figure out the reason, sometimes you can't. You won't always be able to make your baby stop crying. Sometimes all you can do is let your baby know you're there and that you love them. Just like if you were upset and someone you loved sat with you and held you. It may not make your tears go away, but it sure feels good to be comforted. When your baby cries, it's an opportunity to show them that they matter. So know that even though you may not be able to make your baby's tears stop, you are doing something very important. You're making them feel loved. Even in these stressful moments, which can make a mom feel so defeated, know that you are teaching your baby about love. I realize this is small consolation to tolerating what may feel like an eternity, but it is an important truth of parenting. Being there for your child is half the battle. That being said, there may be times that you don't have the emotional reserve within you to be with your baby when they're crying. This can happen. We want to be there for our babies, but a parent can sometimes feel like they just can't take it. Rage can be a symptom of PPD. We never want to yell at or shake our babies. If tears continue and you feel at your wit's end, put the baby safely in their crib. State, "I will be back in a little bit," in a reassuring and calm a tone as you can muster, and then step outside the room. Give yourself some time to calm down. Let the waves of frustration and helplessness subside. Take slow, deep breaths. Cry if it's helpful. If you find you need more than 15 minutes, call your partner, a supportive friend, or family member for support. Remember the Postpartum Support International helpline. You can call 1-800-944 4773 or text 503-894-9453. Some babies are harder than others, much harder, but it doesn't mean they'll be difficult later on. It's just where they are right now. The parents of colicky babies need extra support. Common pitfalls of coping with a crying baby. Taking it personally. When a parent interprets their child's crying as evidence of their failure as a parent, they're setting themselves up for problems. No parent is always able to figure out and fix what's wrong. Sometimes there's not much we can do to make it better. This is especially true when a baby's overtired and having trouble falling asleep. Some babies cry a lot more than others. It's just often their temperament and a stage they're going through. This isn't about you. So if your baby's tears trigger feelings of failure in you, notice that. Then apply some facts and logic to counter that belief. If you can't stop blaming yourself, it's time to talk to a trained professional to release yourself from this weight. Interpreting your baby's crying as manipulation. Babies are not mentally capable of performing conscious, strategic, emotional manipulation. Yes, they can pull on our heartstrings, but they don't do this consciously with the intent of manipulation. In a few years, yes, sometimes a child's tantrum isn't just about disappointment or frustration, but might be manipulation. But this is not true at all of babies. When your babies cry, they are expressing themselves. In the first few weeks of life, it is their only way to communicate. Not knowing when you need to step away. Almost all parents have experienced an episode of crying that just feels intolerable. You feel at your wit's end. Maybe you had yet another terrible night of sleep, nothing has gone well that day, or your baby's having a really bad day. Whatever it is, if the crying feels intolerable, give yourself a break, put them down in their crib, and step out of the room for 10 to 15 minutes. Colic is defined as a minimum of 3 hours of crying a day, more than 3 days a week, for at least 3 weeks in a row. Unless you've listened to a baby cry for 3 hours, it's hard to imagine just how horrible it is. Listening to bad music blaring for 3 hours can be annoying, but to hear your baby cry that long can feel emotionally unbearable. We don't know what causes colic. There are a lot of theories: an immature gut, undetermined food allergy, etc. There are likely lots of causes. One that is often overlooked is an overtired baby. At 3 months of age, your baby will need approximately 16 hours of sleep out of 24. That's usually about 3 to 7 naps per day. Once a baby misses their sleep window, he becomes overtired and much more difficult to fall asleep. You would think that if he were really tired, he would fall asleep more easily, but that isn't the way babies work. Babies need to be relaxed to fall asleep. Once they're cranky and overtired, it's harder for them to enter the sleep state. Notice if there's a pattern to when your baby begins prolonged crying. If you think overtiredness might be part of the cause of your baby's crying, try adding an extra nap about an hour before the time your baby typically begins crying. So if your baby usually begins crying each day around 5 p.m., try giving them an extra nap around 3 or 4. Once the crying actually begins, it's sometimes too late. You've missed that sleep window opportunity. Some experts believe that colic is a normal developmental stage and not due to any physiologic problems at all. These experts dislike the term colic because it implies pathology or illness when there is none. So do your best to remain calm and make extra efforts to take good care of yourself and get support during this time. Colic is stressful for parents. Additional strategies for colic include wearing your baby throughout the day. Babies with colic crave contact. They aren't happy unless they're being held, sometimes not even then. So to give your baby the closeness he needs, you can use a baby sling. It allows your arms to be free but doesn't require the baby to have head control that the front packs do. Young babies often prefer a sling to a front pack. Later, when they're older, stronger, and more curious, they like the front pack so they're able to see the world. The best ones are simple and can be put on with one hand. Once you're able to wear your baby, you can get on with your life while still providing the closeness and comfort they need. There are medicines for colic. Some contain simethicone, a medicine that decreases the gas bubbles in the stomach and further down the GI tract. Studies question the effectiveness of gas drops for colics. However, many parents swear by them, and they're safe to use and cause almost no side effects other than occasional loose stool in some infants. Avoid infant gas formulations that contain sodium benzoate or benzoic acid as preservatives. These chemicals can be metabolized into benzene, a known carcinogen. Another common remedy many parents try is probiotics for infants. Some studies have shown no benefit, while others have shown some. The probiotic with the most evidence of efficacy is Lactobacillus reuteri. It decreased crying by approximately 44 minutes. Look for infant probiotic drops that specifically contain L. reuteri. Discuss using these potential treatments with your baby's doctor. They can also review feeding habits to make sure your baby isn't getting too much air in a bottle feed or too much milk too quickly. Frequent burping during feeds can help this. Talk to your baby's doctor if you think she has colic to make sure there's nothing else going on, such as reflux. Parenting a baby with colic is extremely frustrating and stressful. It can even be stressful on your relationship with your partner. So if your baby has colic, get all the support you can. Maximize your self-care as much as possible. Now you have strategies to maximize both your and your baby's sleep and advice for surviving colic. The next module is about how you get that backup support so you can take care of yourself.